The silent signs of asthma you should never ignore. It could save your life. What if the shortness of breath you've been ignoring isn't just because you're tired? What if that cough that keeps returning every night is actually your lungs crying for help? Millions of people around the world have asthma. Many live normal lives with proper treatment, but thousands still end up in emergency rooms every year because they didn't recognize the warning signs early enough. Asthma doesn't always begin with dramatic attacks. Sometimes it starts quietly, with symptoms so subtle that people mistake them for allergies, a cold, or simply being out of shape. Today, we're uncovering the truth about asthma, the symptoms you should never ignore, what actually happens inside your lungs, and the simple steps that can help you breathe easier. Stay until the end, because one overlooked symptom could make the difference between getting help early and facing a medical emergency. What is asthma? Asthma is a chronic disease that affects the airways, the tubes that carry air into and out of your lungs. In healthy lungs, these airways remain open, allowing oxygen to flow freely. But in someone with asthma, the airways become inflamed. They're extra sensitive to certain triggers. When exposed to these triggers, three things happen almost at the same time. First, the muscles surrounding the airways tighten. Second, the lining of the airways swells. Third, thick mucus is produced. Imagine trying to breathe through a narrow straw that's being squeezed while it's filling up with glue. That's what breathing can feel like during an asthma flare-up. The good news is that asthma can often be controlled very effectively with proper medical care, allowing most people to live active, healthy lives. Common warning signs. One of the earliest symptoms is wheezing. This is a whistling sound you may hear when breathing, especially while breathing out. Another common symptom is persistent coughing. Many people notice that their cough becomes worse at night or early in the morning. Some only cough during exercise. Others develop a cough after laughing or being exposed to cold air. Another warning sign is shortness of breath. Simple activities like climbing stairs or walking quickly may suddenly feel much harder than before. You may also experience chest tightness. Some people describe it as feeling like a heavy weight is sitting on their chest. Others say it feels like a tight band wrapped around their ribs. If these symptoms keep coming back, especially after exposure to dust, pollen, smoke, pets, exercise, or respiratory infections, asthma should be considered by a healthcare professional. Common asthma triggers. Asthma symptoms don't appear randomly. They're often triggered by something in the environment. Common triggers include dust mites hiding in bedding and furniture, pollen during certain seasons, pet dander from cats and dogs, mold growing in damp areas, cigarette smoke, air pollution, strong perfumes or chemical fumes, cold air, respiratory infections like the common cold or flu. Exercise can also trigger symptoms in some people. Stress and strong emotions may make asthma symptoms worse for some individuals, although they don't directly cause asthma. Knowing your personal triggers is one of the most important parts of managing asthma. Not every asthma episode is life-threatening, but some warning signs require immediate medical attention. Seek emergency medical care if someone has severe difficulty breathing, cannot speak in full sentences because of breathlessness, has blue lips or fingertips, experiences little or no relief after using their prescribed quick relief inhaler, or becomes unusually drowsy or confused. These symptoms may indicate a severe asthma attack that needs urgent treatment. Never wait to see if severe symptoms will simply go away on their own. Prompt medical care can be life-saving. Although asthma has no permanent cure, it can usually be managed successfully. Doctors may prescribe controller medications to reduce airway inflammation over time, and quick relief inhalers to relax the airway muscles during symptoms. Taking medication exactly as prescribed, avoiding known triggers, keeping regular medical appointments, and having a written asthma action plan can greatly reduce the risk of severe attacks. If symptoms change or become more frequent, speak with your healthcare provider rather than adjusting medication on your own. Breathing is something most of us rarely think about until it becomes difficult. Asthma doesn't have to control your life. Recognizing the warning signs early, working with your healthcare provider, and following the right treatment plan can help you stay active and protect your lungs. If you found this video helpful, give it a thumbs up and subscribe for more evidence-based health videos designed to help you recognize important symptoms before they become serious. And tell us in the comments, have you or someone you know ever experienced asthma symptoms? What was the first sign you noticed? Remember, this video is for educational purposes only and is not a substitute for professional medical advice. If you have symptoms that concern you, consult a qualified healthcare provider promptly. Thanks for watching, and take care of your lungs. They work for you every second of every day.